Some doctors are saying that the news of this experimental drug is just what the country needs. Nearly 700,000 people across the U.S. have now died from COVID. It's a dark milestone that few experts anticipated when vaccines became widely available to the American public. An overwhelming majority of people who have died in recent months in the U.S. were unvaccinated. Joining us tonight is Dr. Bankole Johnson. He is a neuroscientist and says Merck's new COVID pill is exciting news. Dr. Johnson, welcome to the program. If approved, is this pill a game changer?
I think it will be, because I think we have reached a point whereby when we have vaccinated about 56% of the population, there are a large number of people, the rest of the population, who don't want to take the vaccination for some reason, either for religious reasons, or the fact that they're not quite sure about the side effects, or they may have a medical condition that predisposes them not to be able to use the vaccine. So there are a number of people for which this is important. However, I'll say that it is not a panacea. You know, it's a bit like you don't really want to get the disease to have to be given the medicine. You know, the best medicine is not to get the disease at all. And therefore, that best medicine is served well with having the vaccination against COVID. Now, COVID, as you know, has been a major problem in the United States. It's not only caused the deaths of many, many individuals, hundreds of thousands, about 700,000 people have died, but it's also brought on secondary effects: mental illness, alcohol addiction, drug addiction, a population that is now close to exhausted with problems with regards to the COVID pandemic. So we do need a break, and maybe this is a break that we might be able to get to help us all.
Walk us through any potential risks with a pill like this. And are you concerned that the same people who are afraid of getting the vaccine or don't want to get it for a variety of reasons will look at this pill the same way?
I think they might. And it's the first thing I would say is we don't really know very much about the side effects, because this was a rather small trial of really just under 800 people. Also, if you look at the compliance rate of taking the tablet, this is, I know some doctors are very optimistic, but it's a challenge. You know, most people, it's very hard to get them to take one tablet a day, let alone 8 tablets a day and 40 tablets within 5 days. That is an immense hurdle for most people. And one of the concerns that I would have with such a regimen is that some individuals may take it for one day and then stop taking the second day or the third day. And now you have people now who are sort of partially treated, believing they are properly treated, and now they're back in the society infecting other people.
Right. Sort of how a lot of people, or some people, handle antibiotics. Take some until you feel better, and then you save them until the next time you're sick. Well, we'll see if this works for folks. 8 weeks, pretty optimistic in terms of getting it to market. Dr. Johnson, thank you for coming on. Appreciate the insight.
Thank you for having me on your show. You have a great evening.
You too.